Well, of course, everybody is smiling today. Everybody's ear to ear. But, you know, if your smile has a little dark spot right there because there's no tooth, you know, you don't need to suffer the gaps anymore because of missing teeth. Dental implants are effective, virtually painless, and can really be achieved often in one visit. Dr. Todd Shatkin has been doing this longer than any other dentist in the area from the Aesthetic Associates. He's pioneered a process that can mean a more beautiful smile for you. And we all want to smile today. So how are you? You're smiling today, too.
I'm very happy. It was great seeing those highlights of the second half. I was nervous after the first half, but I had a feeling we'd come back, and so everybody should be smiling. The Bills are playing great. Yeah,
so like I say, if your smile is missing just something a little special to make your pearly whites absolutely terrific from one end to the other, this is going to be your day, because we're going to talk about dental implants, and these are amazing. These are amazing because it might even eliminate for you having a bridge out there and even full dentures.
Well, we've been talking about this now for about 8 years, Linda. I was one of the first, actually I think I was the first in Western New York doing mini implants, and we use them to stabilize loose dentures. I want to touch on that first because there's a lot of people out there that suffer every day with loose dentures that are sore, uncomfortable, that move around, and they can't eat and they can't speak well, and they're worried about the dentures falling out when they bite into something when they're in public, or you know, if there's public speaking, if they're a teacher or you know, a minister or a rabbi or something like that. And so the mini implants, in less than an hour, we can put 4 to 6 mini implants and stabilize a loose denture.
Wow.
And so that's what I think that's what we're showing here. There's a denture with the little O-rings in there, and they get snapped onto the mini implants, and it's just a great procedure. Patients can eat whatever they want. Those are the little implants coming out of the gum, and it looks a little scary, but really it's not. There's no cutting, there's no stitches. It's virtually painless to have the procedure done. The next day, they can eat anything they want.
That's great. And so now you're really getting the room in your mouth back, if you think about it, because when you have that done to the uppers, there's no artificial palate at the top of your mouth. That's you. So you're going to feel, you're going to just feel the texture of the food better and just live a more normal life.
Yeah, and here's a single tooth replacement, a lateral incisor that's missing. And this is the most common congenitally missing tooth. A lot of people are missing this from birth, but other people lose teeth, you know, just from for other reasons. And here we have placed the implant, and the crown is already made in advance and gets cemented on. And so in about less than a half an hour to 40 minutes, they can have permanent tooth replacement.
Amazing.
And it looks great. It functions like a normal tooth. They can eat and brush and floss and all the things they normally do with the tooth. That's great.
And you can order that in the white level of your teeth, and you can have the rest of your teeth brightened.
Well, the great thing is in our office we have the laboratory right in our building, so we make the crowns and the bridge work all there, and the implant crowns can be ordered in whatever shade to match the teeth, and if the patient wants whiter teeth, we can do a whitening treatment in advance.
That's fabulous.
And then do the whiter shade. And of course, if you're not missing a teeth, you can still have your teeth whitened.
Sure, sure you can.
And the laser whiten, the zoom whitening is fantastic.
Has insurance caught up with any of this?
They don't cover the whitening. They cover, some of them do start covering implants.
That's great. And
some of them cover most of them will cover the crown on top of the implant. And most of them will cover the dentures, of course, to put on the implant.
If a child has no tooth because of a congenital problem, or they're missing a tooth for some reason, how young can you do this in patients? About
14 to 15. We like to see all of the permanent teeth in the mouth, and that usually happens around 14 years of age.
Okay.
And then you can do it. And you brought up something very important. Patients who suffer from a gag reflex and they can't wear a denture because the palate gags them, here we can take out that palate completely and place the mini implants in, and the denture will then have these little O-rings in there, and the denture will snap on.
Wow.
You can hear it click.
Yep.
And that's how they can put them in. And then they can taste the food, they can feel the warmth and cold on the roof of their mouth, again, and they don't have to worry about their denture moving around.
And the patient themselves can click that in? Or
they snap it in and out to clean it after meals and things. And then, of course, the lower denture, the same thing. Here's a model of that lower denture with the implants in the in the denture and in the jaw, and then the denture just snaps on.
Wow.
And they don't have to use that denture creams, adhesives.
No slippage, no fear that you're going to be laughing or smiling and then have a problem there.
And it's very affordable. The procedure is done in about an hour, and it's about half the cost of conventional implants in the past.
How long do they last?
Well, the implants should last 12 to 15 years on average. It might last longer.
Wow.
But we say about 15 years is an average life expectancy for crowns, implants.
That's terrific.
Veneers,
that
all that
is so
stuff.
terrific, because that can be devastating, losing a tooth in the front. You don't know what you're going to do.
Well, this model shows the front tooth being replaced with a single tooth implant, and the implant gets put in and then the crown gets cemented right on.
Yeah, I love it because it really looks so natural.
You can make them look just like normal teeth.
That's fabulous.
And here's an example of 3 teeth being missing in the back, and that would be cemented on as well.
Wow. So
these are cemented in place. They don't come out.
They do not come out.
Right.
That's terrific. I think we have a phone call. We have somebody who has a question or a comment. Hi, welcome to the show.
Good morning. How are you, Linda?
Good, thank you. Real
Doctor?
good.
Good morning.
Go ahead, please.
I'm Kathy from Cheektowaga, and I was just wondering, what is the cost comparison as far as a regular denture lower and to have that implant?
All right.
What's the cost?
Yeah, what's it cost, and even comparing it to a denture?
Well, you have your normal denture. We can either use your existing denture or we can make you a new one. We oftentimes can retrofit your existing denture so you don't have to pay for a brand new denture if the denture's in pretty decent shape. The cost varies from patient to patient. The best thing is for you to come in for a complimentary consultation, and we'll do an x-ray and a treatment plan for you, and we'll give you an estimate of the cost.
That's great. So a complimentary consultation.
Yeah.
Boy, you can't beat that. Come on in and get taken a look at, because I would imagine everybody is different.
And we'll do your x-ray at no charge as well. So you can come in for an x-ray, a consultation. There'll be no charge to you, and if you decide to do the treatment, then, you know, we'll do it.
It's a win-win situation.
Yeah.
Yeah.
But I've placed over 7,000 of these mini implants, and I teach, of course, dentists all over the world how to do it. I'm going to Italy in December to give a course to 500 Italian dentists.
Wow,
so
don't stay too long. We could end up in the playoffs if we keep going at this rate.
Yeah, it's early in December. It'll be all right. I'll be back for the
Well, like I said, if you want to be smiling from ear to ear for whatever reason, make sure you make a visit to Dr. Shatkin first, and he's going to have you looking as good as you feel. And the Aesthetic Associates, very conveniently located at 2500 Kensington Avenue. Take them up on that consultation. You can give them a call right now at 839-1700. They want to see you smiling as well. All right, everybody, we'll take a quick break. Be right back.